I'm Jeff Izenberg. I'm an osteopathic physician and I specialize in obstetrics and gynecology. I grew up until the age of 15 in New Jersey, and then my parents moved us to Scottsdale, where I went to high school, and then I went to a little of this college and a little of that college, and I ended up at NAU finishing there, and then I went to osteopathic school in Pomona, California. I went back to Mesa and got into doing my rotations that take place before you graduate school. And while doing them, near the end of my training, I was doing 2 months of OBGYN. And it was time for me to start looking for residencies. And I had always been planning to go into plastic surgery. And I started finding out how difficult it was to get into, and they were on the East Coast, where I didn't want to have to go back to if I didn't really have to. And a physician came up to me and said he was getting ready to start an OB residency at the hospital in Mesa where I had been doing my rotations, and asked if I wanted a spot. So I really enjoy what I do with OB and GYN, and I said, sure, why not? After that, I practiced in Mesa. I joined the practice with one of the doctors who trained me in residency, and I was in practice for 12 years down there. I was interested in this area and called the hospital and asked if they were looking for any physicians for OBGYN, and they said, well, as a matter of fact, we know one that's getting ready to retire. And it just so happened to be that I trained him when he was a resident. Now, the nature of this business is you can get called out at any time to go deliver a baby, so you never know when that's going to happen. And we spend a good part of the morning seeing patients, then we go do our lunch, maybe I'll go do rounds or I'll go do some surgery, then come back and see patients in the afternoon. You know, you really get to know the patients quite well because the town is only so big, and I'll run into patients at restaurants. And in the short time I've been here, I've come to know quite a few of them very well. The small town atmosphere is a lot different than the big city where I grew up, basically. Well, when I started doing it during my time as a student, I got to deliver a lot of babies. I got to assist on a lot of surgeries, and surgery was really important to me. Like I said, I wanted to be a plastic surgeon, so I was set on something surgical. And delivering babies was a lot of fun. You know, there's a lot of enjoyment in seeing the joy that the families have during that time. And it just kind of, things rolled the right way, and I ended up here, and you know, I've really enjoyed it. I have 2 children, a son that is 12 and a daughter that's almost 10. They live in Mesa. I go see them whenever I get the chance to, or they'll come up here and spend some of their longer breaks with me. I like to take them fishing and camping and skiing. I'm trying to get back into golfing again. I love to scuba dive when I get the rare chance to do so. And I love to play poker. What I take away from it is just getting to take care of them is satisfaction for me. Getting to see the sick ones get better, getting to see the patients who are having babies get a great amount of joy out of it. And patients come back and do it again.